Universal Precautions.
Universal precautions are a standard set of guidelines aimed at preventing the transmission of bloodborne pathogens from exposure to blood and other potentially infectious materials. Community-acquired infections. Infections that are contracted outside of a hospital and diagnosed within 48 hours of admission without any previous healthcare encounter. These are the examples for community-acquired infections: bedbugs, scabies, and ringworm. Domestic universal precautions. Hand hygiene. Steps for hand washing. Step 1. Wet your hands with water. Step 2. Apply enough soap to cover all hand surfaces. Step 3. Rub hands palm to palm. Step 4. Right palm over left dorsum with interlaced fingers and vice versa. Step 5. Backs of fingers to opposing palms with fingers interlocked. Step 6. Rotational rubbing of left thumb clasped with right palm and vice versa. 7. Rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. Step 8. Rub both wrists in a rotating manner. Step 9. Rinse hands with water. Advantages of hand washing. It helps us to avoid the spread of pathogens through our hands and prevent our nails and skin from superficial infections and make ourselves look clean to maintain a positive impression of ourselves with those whom we interact with. Why do we need to wash our hands? This is because we use hands to do many things in our daily routine. We may come in contact with many pathogens everywhere in the environment. They may cause infection when we use contaminated hands to rub our eyes, eating food with bare hands, or even help in the transmission of airborne pathogens. Hence, this is why we need to wash our hands more often. Indications for hand washing. Before and after any direct patient contact and between patients, whether or not gloves are worn, immediately after gloves are removed, before handling an invasive device, after touching blood, body fluids, secretions, excretion, non-intact skin, and contaminated items, even if gloves are worn. During patient care, when moving from a contaminated to a clean body side of the patient, and also after contact with inanimate objects in the immediate vicinity of the patient.
Clean used area with disinfectant. Toilet. When we use the public toilet, we might be exposed with numerous pathogens in the toilet as it is commonly shared facility with strangers. Therefore, getting several infections when the organisms are delivered into our bodies are of high risk if proper cleaning is not practiced regularly, as bacteria easily contaminates toilet seats, lids, and nearby surfaces. Why do we need to clean used area with disinfectant? It is due to the leftover food after use in the kitchen. This will leave a platform that is suitable for the growth of pathogens in the food. The infection may spread when our hands are contaminated by the pathogens when in contact and delivered to our body. The advantages of doing this are: it makes our toilet and kitchen look more appealing, prevent the spread of waterborne and foodborne pathogens, remove the platform for the growth of pathogens and spores. Proper disposal of waste. Although household refuse doesn't usually contain such large amounts of germs as excreta, it can cause a risk to public health by attracting flies, mosquitoes, and rats, and allowing them to breed. This may encourage the spread of diarrheal diseases as well as diseases like dengue fever, yellow fever, Bancroftian filariasis, and also bubonic plague. When refuse is stored in the home, even for only a few hours, it can attract flies and rats.
Community universal precautions. Face mask. During the outbreak of COVID-19 across nations, people are prompted to use medical face masks for preventing further infection of COVID-19. Doctors recommended disposable face masks as one of the best ways to protect ourselves from inhaling dust, particles, as well as the virus. The right way to wear a disposable face mask. The side of the mask that has a stiff bendable edge is the top and is meant to mold the shape of your nose. Determine which side of the mask is the front. The colored side of the mask is usually the front and should face away from you, while the white side touches your face. Advantages of face mask. It reduces the chances of directly coming in contact with infectious pathogens. They are also tight-fitting and can filter out up to 95% of airborne infections. Face masks also prevent spreading of infectious pathogens from an infected person.
Hand sanitizer. Doctors recommend the use of hand sanitizer and soap in proper hand washing. This is because throughout the day, our hands are covered with germs. Our hands are in contact with our mouth, eyes, nose, and other parts of the body. Normally, we use water and soap to wash our hand, but an alternative way is by using hand sanitizer. Advantages of hand sanitizer. They may eliminate up to 99.9% of the germs on your hands. Hand sanitizer are easy to use and can be brought anywhere we go as they are portable. It also reduces the risk of getting diseases in the crowded areas like the office, campus, or market. Hand sanitizer without alcohol content may reduce the effect of dry skin.
Respiratory hygiene, cough at home. These are terms used to describe infection prevention method to decrease transmission of respiratory illness. For example, coronavirus and influenza. This virus can spread when an infected person coughs or sneezes to another person. The droplets released can travel for several feet, reaching the nose or mouth of the others. Next, respiratory hygiene can be achieved by using tissues to cover mouth or nose and discard contaminated material to the trash. Or if the person has symptoms of persistent coughing, it is recommended for them to use masks to prevent the spread of disease. Advantages of respiratory hygiene. It decreases the risk of respiratory disease and infections and provides a better and healthy lifestyle to a community.
Social distancing. Social distancing is crucial for preventing the spread of contagious illnesses such as COVID-19. This includes avoiding mass gathering or maintaining distance of about 1 meter from others when possible. We can reduce our chances of catching virus and spreading it to our loved ones within our community. Advantages of social distancing. It reduces the spreading of contagious illnesses such as COVID-19. It helps limit opportunities to come in contact with contaminated surface and infected person outside home. It reduces our chances of catching virus and spreading it to our loved ones within our community.
Impact of community-acquired infection among the community. It will reduce the quality of life, increase the mortality rate, prolong hospital stay, and significantly increase healthcare expenditure. Importance of environmental cleaning and proper healthcare and waste disposal. Environmental cleaning is a fundamental principle of infection prevention in healthcare settings. First, to have a pollution-free atmosphere. Second, to relieve the society from any form of contagious diseases. Third, to avoid cross-contamination. Fourth, contaminated hospital surfaces plays an important role in the transmission of dangerous pathogens including Clostridium difficile and antibiotic-resistant organisms such as methicillin-resistant Staphylococcus aureus (MRSA) and vancomycin-resistant enterococci (VRE). Therefore, appropriate disinfection of those surfaces and equipment which patients and healthcare personnel touch is necessary to reduce the exposure.
Missing someone